Hi, this is in continuation of the previous video on 4 factors that determine fertility. These 4 components are also essential for conception to take place. In this video, I'll be telling you about the first factor or the first essential component, that is regular menstrual pattern. So how do we evaluate a menstrual pattern? This is dependent on a lot of factors apart from the general Ayurveda investigative protocol like dosha, doshya, kala, anala, prakriti, vayaha, etc. Let's make it a little easier as well as interesting. Grab a sheet of paper and jot down your answers. Get ready for a self-assessment questionnaire. Question number 1. At what age did you have your first menarche? A. Between the age of 10 to 14 years. B. Before you turned 10 years. Or C. After the age of 14 to 15. According to our classics, 12 years is the age when menarche sets in. Precocious puberty is a condition where menarche starts earlier than 10 years. If your answer has been yes to B and C, then meet your doctor to rule out certain possibilities. Question number 2. This determines on the characteristics of menstruation. So, how many days once do you get your periods? A. Does it follow a regularity, like once in 28 days, once in 30 days, or 35 or 40 days? Or B. Is it irregular, where you cannot predict as to when you may have your menstruation? If your answer has been yes to B, then it is better to get it regularized before the pathological condition worsens. Question number 3. For how many days do your periods last? Here we are trying to find out the duration of flow. A. Is it between 2 to 7 days? B. Lesser than 2 days? Or C. Heavier than 7 days? So menstruation is a result of cyclic changes of the endometrium, which is the inner lining of the uterus. So a spotting, streaks, heavy menstrual flow or blood flow says that the endometrium has to get a little healthier. So if your answer has been yes to either of the last 2 options, then it's time to consult your doctor and set it right. Question number 4. Here it is to find out the volume of menstrual flow. This is usually determined by finding out the number of pads or tampons used during periods. So an additional information which comes into this category is whether there has been clotted flow or plain spotting with a lot of mucus, or just no flow, just some mucus discharge. So all of this, and also the color of the flow, if it's blackish brown, maroon with clots, pinkish, or any other color apart from red. If your answer has been yes to this, then get it checked. Question number 5. Are your PMS bothering you? It could be anything from menstrual cramps to bloating to constipation, breast soreness, vaginal discharge, or body aches. A. Just the usual discomfort. B. This has been there from a long time. C. Lately has started to affect a lot. If your answer has been yes to B and C, then it is important to know that PMS, according to Ayurveda, is more of a Vata dosha dysfunction, of course sometimes associated with either Pitta or the Kapha, and has to be corrected as they can pose or they can be predominant symptoms of certain conditions. Now the 6th question. So this is to do with ovulation. Have you observed a translucent vaginal discharge between the 10th to 20th day of your menstrual cycle? A. Yes, and also sometimes associated with mild lower abdominal pain, that is absolutely fine. B. Usually it is dry. Or C. Discharge is there throughout the period. So if you have ticked yes to B or C, then it is time to get it diagnosed rightly for further correction. If your answer is A, then you are likely to be ovulating. So hope this has been helpful and has brought clarity with regards to the first of the factors which determine fertility and also for conception. So now gynecological history and obstetric history will be needed for evaluating infertility conditions. So when I say gynecological history, this will include past and present diagnosis of PCOD, vaginal discharges or fibroids, endometriosis. Obstetric history will include the age of marriage, parity, number of miscarriages, termination of pregnancies, etc. Of course, contraceptive methods, metabolic issues, past medical or surgical interventions, smoking, alcohol, occupation, social, family history will also influence menstrual patterns, but these will be evaluated more elaborately from your doctor. So in the next video, let's go on to find out more on healthy reproductive organ.